key announcements from top health officials in the past week regarding COVID vaccines.
Health Secretary Robert Kennedy Jr. directing the CDC not to recommend COVID vaccines to healthy kids and pregnant women, and the FDA planning to limit access to the vaccine for many Americans. So joining us now is Upstate Global Health Director, Dr. Stephen Thomas. Dr. Thomas, good to see you. Thanks for stopping by here. Appreciate it.
Yeah, it's nice to see you.
A lot to get to. Let's start with this before we get to those issues.
Yeah.
New formula, right? The advisors looked at it last week. What is it and what's it kind of targeting now?
Yeah. So all the different groups that make recommendations, including the WHO, other regulatory agencies, and the FDA, have basically said to kind of stay within the same family that we're already in, which is sort of the JN1 lineage. They did say that they preferred that the manufacturers go to the most common strain that's circulating in the United States now, this LP81, but they said it was preferred. So it's tough to know whether they're going to make them actually do that, or whether they can, continue to use what they're doing now. But we're going to basically be staying kind of where we are, which is good news.
Yeah.
It is good news. How much has the COVID virus mutated? Because it seemed like for a while there it was, new strains were popping up all the time.
New strains do pop up all the time. That's what viruses do. They mutate. They're trying to find some advantage, And there's a new strain that China, Taiwan, and Hong Kong have reported some increasing hospital admissions associated with that. That's probably more due to the summer surge than it is an actually more virulent form of the virus. But it has touched down in this country. Too few cases to make any kind of assessment about whether this is going to be a problem or not. So they'll continue to take a look and see.
How soon will you know that?
Oh, they've only collected about 500 cases or so, and it takes thousands of cases.
Okay.
To figure that out.
We're not there yet.
We're not there yet, and hopefully we don't.
To some of the issues we talked about off the top, the Trump administration and the health officials within that administration, they have a plan to limit access to the vaccine. I mean, how do you understand this plan? What does that mean? We just all can't go out and get it now?
Right. Well, the first thing I understand is that they didn't follow the process that we normally use. So normally, the FDA will decide whether a vaccine is safe and effective, and then the ACIP, which is part of the CDC, they will determine how it should be used. In this case, FDA leadership came out, and then the secretary came out basically saying, this is what's going to happen. And what this means is that if you're over 65, you can have access to the vaccine. They're going to recommend it. If you're an adult under 65, you got to have a pre-existing, you got to have a medical condition that places you at increased risk of a bad outcome if you get infected. That's a very, very long list, including, physical inactivity.
Wow.
Whatever that means, whatever that means, and so that's on the list. What the real outcry here is that kids, especially younger kids, who can have just as high a risk of ending up in the hospital and having a bad outcome as older adults, and pregnant women. We know for a fact, it is indisputable that women who are pregnant, who get infected, can have a lot of serious side effects, not only for them, but also for the child, and vaccination can significantly reduce that risk. Nobody knows whether pregnancy was not on that list, and nobody knows what's gonna happen there. So there are some big groups that now don't even necessarily have a choice under the current recommendations.
So are you concerned this fall, healthy people who don't fit that criteria are going to be denied access to getting the updated COVID vaccine, or is there another way to get it?
Yeah, so the way to get it would be that you have somebody who's willing to prescribe it to you off-label, right? Which this happens a lot in the medical field.
It doesn't mean it's like a back alley or a dark alley or something, right?
But you got to get somebody who's willing to prescribe it off-label, which as a clinician gives you a little bit of angst. And then the second thing is the insurance companies may not have to pay for it. So limiting access, it might not be that, well, you can't get the vaccine, but it might be, well, you can't afford to pay for the vaccine. Right. That's how you can have limited access, and that targets a very specific group of people.
Obviously, you're an infectious diseases doctor. You've been doing this for a long time. So your opinion on limiting the COVID vaccine like this, could we see a surge of COVID again? Are we at that point where, hey, maybe everybody doesn't need it?
Right. Well, I think, I have a very open mind, and I think that you should always be looking at the data, because the data changes, and if the data changes, then your recommendations can change. And I know that multiple FDA meetings and multiple CDC meetings previous to this one over the years have always questioned the idea of healthy people, especially healthy young people, of getting annual vaccination. So I don't dispute that that's a question that should be asked, but this is a question of do you give people the choice to have that conversation with their medical provider of whether or not they should get it. One simple example, let's say you have a family, 2 healthy adults, 1 healthy child, 1 child that has some immunocompromising condition. Those 3 people might want to get vaccinated to reduce the risk of transmitting to that child. They may not have an option to do that now.
Wow.
That's the kind of scenario that I'm worried about, that more than a surge per se. I'm worried about those individual people not being able to make choices.
Right.
Do you think there's any, I mean, would you think there's any change coming, or is this kind of what they announced? I mean, this is it. Well,
although it's a little unprecedented, the Secretary has the ability to be directive in this way. And to bypass a process which has been established over a long period of time using disinterested, objective people sitting on committees who review the data and review everything else and the science behind things. And this is a little bit different, and it doesn't seem as scientific or data-driven as I think they may be projecting it is.
Right, and your message would be, look at the science, look at the data, obviously.
My message would be, get your information from lots of different sources and have a conversation with your clinician, the person you trust to take care of you and your family, to make a choice that is in your best interest.
And we're going to continue the conversation with you here as the weeks and months go on, because, you know, this is new. We'll kind of see how this goes as we get closer to the fall. So we'll always have you back. Thanks, Dr. T. Appreciate you.
Thank you.
Dr. Thomas, thank you.